Joining us now is Amesh Adalja, senior scholar at Johns Hopkins Center for Health Security. Amesh, always good to see you, my friend. Let's start with these numbers. We heard there are now more than 100,000 daily cases. We're on a string of these. I heard someone say the other day, in January, we will wish for a day like this. Do you agree with that?
I do think that what we're going to see is an intensification of spread. What we're seeing is a lot of pandemic fatigue, people not wearing face coverings. We're seeing people having gatherings where there is spread occurring. And we know that this virus does intensify spread when it gets colder, when people move activities indoors. So I do think we are likely to see it get worse before it gets better.
Well, we heard the governor of Wisconsin now advising residents there to stay at home. Do you anticipate more advisories like this or even more shutdowns?
I don't think that we're going to go the way of shutdowns. We know that those have a lot of auxiliary complications when we see people out of work, when we see restaurants shutter, when we see hospitals not able to do non-emergency care. There are lots of negative consequences. What I think will happen is more targeted public health, where you see people looking at the case contact data, seeing what's driving infections, what isn't driving infections, and then really targeting those types of things. Shutdowns are going to be something that you might only see for a very limited amount of period. For example, you're seeing that already in El Paso, Texas, where it's very directed and it has kind of a sunset clause to it. I don't think you're going to see open-ended shutdowns in the United States for large swaths of the country or even a whole state.
It might appear to some that this is an all or nothing proposition. Amesh, I'm wondering, we don't clearly want to kill business. We don't want to kill people either. Is there some middle ground? Is there some way for us to get here that would take care of both of those concerns?
This has been a false alternative that people have been pushing forward for a long time, that it's either shutdowns on the one hand or letting the virus run rampant on the other. The actual way to do this is what we've been saying from the very beginning. Test, trace, and isolate. We have to have better testing. We have to have contact tracers that are emboldened, that actually have proper resources put towards them, where public health is actually valued and that infrastructure is built. And then you get a system where when cases occur, you're able to intervene quick enough before they start a chain of transmission that lands on a vulnerable population. That's what Taiwan did, that's what South Korea did, but that's what we've been unable to do since the very beginning of this pandemic.
Let's talk about the vaccine. A lot of positive reaction yesterday. What are the hurdles you see for this vaccine, and do you consider it a game changer or a silver bullet?
I do think that this vaccine has very positive results, better than we expected. We didn't think it would be 90% effective at preventing infections, but it's a long way to go from a vaccine to a vaccination program. So we have to first wait for safety data, then you would get an FDA emergency use authorization. And then the problem comes with trying to scale up production. Remember, this is a 2-dose vaccine, so that's 600 million plus doses that we need to make to vaccinate this population. And it's a vaccine that requires what's called an extreme cold chain. So it has to be kept very, very, very cold, -70, -80 centigrade. That's logistically difficult. So we do have a long way ahead of us. Everything looks great with this vaccine, but we don't want to give ourselves, a false sense of security, because this is not going to be something that the general public has access to well into 2021. So we're going to go through this winter, which is going to be a harsh winter with this virus without the vaccine. So we need to still continue to be vigilant, continue to social distance, wear face coverings, wash our hands a lot, and try to avoid crowded and congregated places.
So you just touched on this a minute ago. Despite the hurdles, the number one concern people seem to have is safety. Is that an issue for you?
I do think that so far what we've seen in phase 1 and phase 2 clinical trials shows this vaccine to be something very safe. We're waiting for some more safety data from the phase 3 clinical trial, which should come probably in the 3rd week of November from what we've heard from Pfizer. And then we're obviously going to study this vaccine for a long time, even after we start giving it to people, to look for longer term complications. So far, there are no red flags, but we have to, with a vaccine, there's always this risk-benefit ratio. And remember, you're giving a vaccine to a healthy person, so you have to make sure that it doesn't cause anything worse than the disease. So you have to really look at those people for a while. And I don't think we'll have a full safety picture until well after the emergency use authorization. So we're going to be studying these vaccines for some time, even after we've given them to people, to understand the full safety picture. But so far, what we've seen is encouraging. There's nothing that really puts me off on this vaccine. I think this is something that likely will be safe and effective.
How do we get to this efficacy number, Amish, of 90%? At this point, we don't know who got the placebo, who got the vaccine, right? For starters.
So Pfizer does know, and the Independent Data Safety Monitoring Board does know where the cases occurred, where they didn't. And what we know is that there were 90-something cases that occurred, the majority of which were in the placebo arm. Those who got basically a shot of an innocuous material twice versus those who got the actual vaccine. So there is robust data that at least has been put in a press release form. What we're all waiting for is to see the peer-reviewed publication in a medical journal, so we can actually dig into the data and pore over it and try and understand all the nuances of it. But it does seem to be that this is intact data, and we may see that 90% number fall a little bit once we get more and more data, more and more patients enrolled, more and more data from other individuals as the trial continues. But I do think this is much better than what we thought. We thought it was going to be 50 to 60% effective at preventing infection. So this is something that I think really surprised a lot of us, especially with the first generation vaccine. And it's something we should be enthusiastic about, but there are some caveats because we don't have the full picture yet.
All right, Amesh Adalja, thank you very much, senior scholar at Johns Hopkins. We appreciate your time and the information as well.
Thank you.